Examination of the cranial nerves gives us a way to look at the brainstem, all the way from its most rostral extent to its most caudal extent. If we look at an enlarged model of the brainstem, we realize that there are actually two cranial nerves that are tracts of the brain that are just at the top of the brainstem, cranial nerves number 1 and 2. And then for the three main divisions of the brainstem, the midbrain, the pons, and the medulla, we can divide the cranial nerves into each one of these three sections. Cranial nerve number 3 and 4 are in the midbrain. Cranial nerves number 5 through 8 are in the pons, and 9 through 12 are in the medulla. So the cranial nerves can be divided into 2 for the midbrain, 4 for the pons, and 4 for the medulla. The second anatomical point that's important to remember is that for all the cranial nerves, except for one minor exception that we're not going to focus on, the clinical findings are on the same side as the involved cranial nerve in its nucleus. The last point that we need to keep in mind is that these cranial nerves again give us valuable Y levels on the vertical axis of where we may be in the brainstem. And that combined with long track findings from those descending and ascending tracts are powerful in localizing brainstem lesions or brainstem pathology. So let's look at these cranial nerves in a little bit more detail.